For wholesale and retail prices, contact Sheikh Lisha Limited, Warrenville, Conopia. Sheikh Lisha Limited, quality you can trust.
Assalamu alaikum and welcome to another episode of Doctor in the House. I am your host for today, Dr. Tawfiq Hussain. And as I previously mentioned, I am a family medicine doctor. Having completed my studies in medicine in 2019, I went on to work at the Southwest Regional Health Authority in various specialties, starting in accident and emergency, progressing to ICU and anesthetics, then to general surgery and medicine. I finally settled in primary care, where I am now practicing as a family medicine physician in the health centers in County Victoria South. I have completed my postgraduate diploma in family medicine, and I'm currently pursuing a Doctor of Medicine in family medicine. Today, I am joined by one of my close and dear friends, Kareem Kasim-Ali. Kareem often tells people that I am his oldest friend, but I often have to clarify that he may have friends who are older in age, but definitely they are not friends with him as long as I have been friends with him, because I have been friends with him since preschool, which is about 28 years ago. Now this may divulge our age, but we are very close friends. So, Assalamu alaikum and welcome, Kareem.
Wa alaikum assalam, Tawfiq, and thank you for having me here today.
Okay. Kareem, can you tell us a bit about your career and a little bit about yourself?
So, as Tawfiq, as you said, we've been friends since 1997, so 28 years ago. So now everybody can calculate how old we are. You're older than me though. So, I've been an optometrist for the past 6 years now, graduating from UE Optometry School in 2019. And since then, since 2019 to around 2025 May, I've been working as a clinical demonstrator at the University of the West Indies Optometry Program. I also worked locum or on call when I now graduated as well. So it was a sort of part-time basis. Then I started to work full-time at a private practice, and now I'm working full-time at the Trinidad Eye Hospital optical section, so TEH Optical, for the past year and a couple months.
Okay. So you have a vast experience in different capacities in optometry. Now, I want to ask you a question that often confuses people. We hear a lot of terms in this field. We hear optometrist, ophthalmologist, optician. And a lot of people get confused. What is the difference between these careers and these roles, Kareem?
Yeah, so that's a really important question, Tawfiq. A lot of people get it mixed up. Like sometimes I'll be seeing a patient and they get a phone call and they'll tell people, well, I'm by the optician doing an eye exam, or I'm by the eye doctor doing an eye exam. So firstly, let's start with an optician. An optician is someone who is professionally trained to dispense glasses, in some cases also contact lenses. They can repair glasses and make the lenses. So they sort of like, they will produce or manufacture the glasses to the specification, that the optometrist would have diagnosed and determined. The optometrist is a person who is responsible for primary eye care, like myself. So we can do eye exams not just for glasses, but also detect severe and significant eye diseases, things like glaucoma, cataract, and we are said to be the primary eye care, the first line of eye care that a patient should go to. And then we have now the ophthalmologist, who is like secondary eye care. So they are medically trained doctors like yourself who went on to specialize for sometimes as much as 7 years to be an ophthalmologist, an eye specialist, and an eye surgeon, who will then take the initial diagnosis of the optometrist and they will investigate a little further and confirm the diagnosis of the patient. And then they are the ones who will treat either with eye drops, either with certain medications and different types of therapeutics, or in some cases even do surgeries.
Very important information there, Kareem. So now people have a better idea who to go to in these cases. So if you need glasses, you might want to visit an optometrist.
Correct.
If you need an eye surgery, you might want to go to an ophthalmologist. And now when your glasses getting dispensed, you'll go to the optician.
Yeah, so most of the time, Tawfiq, the optician and the optometrist kind of work together and hand in hand, because the optometrist will do the eye exam and they will determine the spectacle and the contact lens prescription.
Yeah.
And then we will now hand over to the outside where the optician would be. So they will help the patient choose a glasses frame to match with their face, proper size, it lines up with the eyes properly. So that way when they make the lenses to go into the glasses, it lines up with the patient's eyes. The patients are comfortable with their vision, comfortable with the physical feel of the glasses, and then they can see good and they can function well.
Okay. So a lot of clarification going on here for those at home who may be confused by these different rules. So Kareem, I always boast everybody that I have a friend who is an optometrist, and you are very passionate about what you do, having taught medical students, teaching optometry students. So for those at home who might want to get, the younger folks who might want to get into a career of optometry, can you just tell us a bit about how to become an optometrist?
Yeah, definitely. So firstly, it is for me, it's a very fulfilling career. Imagine if you don't have your eyesight, you lose a lot of independence. So a lot of students who I would interact with, just the other day I was in a couple of secondary schools talking to some students, and one student, he came and he asked me, he said he liked the eyes, he liked seeing, he likes promoting independence, because without your eyesight, it's difficult to read. I mean, it's not the end of the world, but if you lose your eyesight, you can't achieve much, you can't do a lot of things. You can't enjoy the beach, you can't enjoy beauty to an extent. So in order to be an optometrist, Tawfiq, firstly, for Form 5, for CSEC, you must have physics. That's really important. Physics is important, right? So you must have your 5 passes, but physics is one of them. Biology, chemistry, those are very important. Then at Form 6 level, you need to have your sciences as well. Physics, and I believe now the requirements is physics and chemistry, and then either biology or mathematics, or both if possible. And then you must make good grades, and thankfully right here in Trinidad and Tobago, we have at UWI St. Augustine, we have the optometry program, right? For quite some time, they boast that they were the only optometry program in the English-speaking Caribbean, right? I believe in Haiti, there's an optometry school as well.
Okay.
But yeah, it is a very, very fulfilling career, especially when you can make a difference, whether it be with a senior citizen, whether it be with a secondary school child, a primary school child, and you're going to help them. But for me, really and truly, the young people and the very old people is something I'm real passionate about helping. Just like yourself, you help them, you help the young ones, and you can promote and help them lead a successful life by giving them good vision, and in your case, good health. And then for the older ones, they may have little time remaining. And you let them be comfortable and happy for whatever time that they have left. To me, that's really, really fulfilling. And I think it's an important role that optometrists play in society.
Okay. So very important information there. A little difference is see between optometry and medicine, where medicine we more focus on biology and chemistry at the A levels, and physics playing a more important role in optometry, perhaps because of the refraction and the lenses and the way the angles and so on work, right? So Kareem, we want to get a little more into eye health here. right? We want to know and talk about the common conditions in eyes. So oftentimes, working with ophthalmologists, you might hear the eye is a window into your overall health. The way how your eye presents, that is how your body might present, and it reflects the health of your body, right? So what I want to ask you is, what as an optometrist, what are some of the common conditions that you would see in your everyday practice, aside from the normal refractive area where a person might come for glasses? What are some of the other conditions you might see?
Yeah, so definitely the refractive error is the main concern that the majority of people will come to the optometrist for, Taufik. What is very, very common in Trinidad and Tobago and in the region is dry eyes and ocular or eye allergies. Very common. You know, a lot of us, we on our phone, we on our computer whole day, and we staring at things, and it contributes significantly to dry eyes and eye strain, right? There's a lot of patients who will come in, mostly older people, but also younger people, diabetic issues with the eyes, right? Some people, you will find maybe signs of glaucoma, signs of hypertension, a lot of infections and stuff, patients who don't take good care of their eyes. They don't practice proper good hygiene. They're rubbing the eyes all the time. It could lead to a lot of eye infections as well. Yeah?
All right, yeah, so very important stuff there. And now, when your eye is affected, it affects your whole body, your whole character, right? It affects you a lot because that irritation of your eye makes it so uncomfortable, right? So, as you spoke about dry eyes cream, let me hear a little bit more about the dry eyes.
So, Taufik, the tears in your eyes, it consists of 3 layers, right? The closest layer to the eyes is a mucus layer. Then in front of that, we have a watery layer, and to the front of that, we have an oily layer. So those 3 layers need to be produced properly in order for the eyes to be well lubricated, also in order for you to have good vision. Right? The cornea, which is that clear layer over the colored part of the eyes, the part that always looks glossy when you take a photo, that layer is avascular. It doesn't have any blood vessels on it. So it depends on the atmosphere for oxygen. So oxygen is absorbed. And if the eyes are not dry, if the eyes are dry, then oxygen will not be absorbed properly onto the cornea. And the only way that the body knows to send oxygen to anywhere in the body is really and truly through what? Through blood, right? So if blood vessels now start to go onto the cornea, it's going to cause some problems. The cornea will move from being clear to becoming a bit opaque. And that's how serious dry eyes can be. And now dry eyes, Taufik, is a very, very simple fix, right? Once we diagnose dry eyes and the nature of the dry eyes, oftentimes we can treat it with either simple eye drops. There are different types of eye drops depending on the nature of the dry eyes. Right? Sometimes you might tell the patient frequent breaks from digital devices, frequent breaks from staring at even a novel. So it's not just digital devices. I know there's a lot of things going on about digital devices. We say people think it's evil. But it's really and truly, when you stare at anything, whether it be a book, whether it be a screen, your phone, you're going to stare, you're not going to blink. And that contributes to the eyes being dry. Also, good eye health. Sometimes there's glands on your eyelids that can become clogged. Those are the glands that secrete the oily part of our tear film. And if those glands aren't being produced, those glands aren't being functioned well, it's not going to produce enough tears, enough oil on the tears, and that's going to cause the tears to dry up faster. You know, so once we determine the nature of the dry eyes, then we can treat it. It's not just going to the pharmacy and buying a random eye drop and using it, because sometimes those eye drops could cause more harm than cure.
Yeah. So, I'm glad you mentioned the eye drops, because a common problem we face in Trinidad with all the Sahara dust, all the smoke with bushfires, all the pollen, everything that is in the environment, a lot of patients come with eye irritation, often due to allergies. You know, patients have allergic rhinitis. They have allergies that make their eyes red and itchy. And they go to the pharmacy, and the pharmacist would recommend a whole set of different kind of drops for them.
Yeah.
Right? And patients often become confused. Sometimes they might take a drop that might worsen the problem. So what advice would you have for these kind of patients?
So a lot of patients who would have burning eyes, itchy eyes, irritated eyes, they tend to go and they get what they normally recommend an antihistamine eye drop. But there are different types of antihistamine eye drops, all right? And they are different, and they work differently. What the antihistamine eye drops do, they will constrict the blood vessels in the eyes. I wouldn't call the brands of them, but they would constrict the blood vessels in the eyes. They are very old antihistamine compounds, and they can have a rebound effect. So you're treating the eyes because they're red, you're putting some drops in the eyes, and then a couple of days down the road, the eyes get more red, right? But really and truly, the eyes may not be irritated because of an allergic reaction. It might more be irritated because they're dry. So that's why it's very important to go to the optometrist, go to the ophthalmologist if you want to, right? And let us check it and determine the nature of the dryness, nature of the symptom that you're experiencing. So we can not just treat the symptom, but we can treat what is actually causing the symptom, right? And then that way you have a longer lasting benefit and results, yeah?
So in other words, not all eye drops are created equal. Some may actually be beneficial while others may be harmful.
Yeah, using them in the wrong way, like even using certain medication tablets in the wrong way could cause harm. It's the same thing with the eye drops. They can cause harm to the eyes. So we have to be very careful what we put in the eyes and how we put it in the eyes.
Right. So when you're using these eye drops, you always should seek advice from a medical professional such as yourself.
Correct, yeah.
Or even any doctor who might be able to advise you which drop you should use in which cases.
Yeah, I definitely agree with that, yeah.
All right. So we want to move on a little bit to one of the major things that affect eyes in Trinidad, perhaps due to the burden of the disease itself. And the disease I speak of is none other than a major killer in Trinidad, which is diabetes. However, before we discuss this, we want to go to a quick commercial break. So we'll be back to talk about diabetes and the eye.
Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? Never too early, never too late to recharge and hydrate. Get your daily dose the right way. Grab an Oasis, now why wait? The greatest, the safest Oasis for sure. Oasis, it's purer than pure.
Fruitopia, the drink that rocks your lunchtime. Fruitopia, Fruitopia, it's a drink that's high. The citrus punch, fruit punch tastes nice. Guava, pineapple, that give me a vibe. We no want nothing less compared to the rest. Fruitopia the best. Punch any thirst when it comes to the test. Perfect thing for my lunch. Flavors pack a punch. Fruitopia, Fruitopia, it's a drink that's high. The citrus punch, fruit punch tastes nice. Fruitopia, the drink that rocks your lunchtime.
Try our new passion fruit flavor today. Taste the passion.
Assalamu alaikum and welcome back to Doctor in the House. So we are chatting about eye health. I'm here with my friend Kareem. So Kareem, diabetes has a high burden on the healthcare system in Trinidad and Tobago. A lot of people are afflicted by the complication of diabetes. Now, the complication of diabetes could be characterized both by micro and macrovascular complications. Now, one of the main and first microvascular complications that patients face is the dreaded diabetic retinopathy, right? It's a high burden on the healthcare system and a high incidence among patients, especially patients who present a bit later on into the disease of diabetes. So tell us a bit more about this complication of diabetes, diabetic retinopathy. What does it entail? What are the types? How would you screen for it? How would you find it, and what would you find? How would it affect the eye?
Yeah, so Taufik, diabetes is definitely a huge issue in Trinidad and Tobago, in our population and our ethnic makeup, right? I'm sure probably every single person in Trinidad and Tobago knows somebody who's diabetic,
Very true.
right? That's how prevalent it is. And it is, we know it have that strong hereditary link, and it's linked a lot to our lifestyle and our diet, right? You mentioned before the break that the eyes are the windows to the soul. And in the eyes, it's the only part of the body that we can see a nerve or nerves and blood vessels without actually cutting, right? We can look into the eyes using different tools to examine blood vessels. And these are very tiny blood vessels. So diabetes is a vascular issue, right? And oftentimes, if it's going to affect the blood vessels, it will affect the small ones first. And the eyes have some of the tiniest, if not the tiniest, blood vessels in our body. So we will notice, or we will see, damage happening to the blood vessels sometimes even before the patient knows that they're diabetic. And this is why eye exams and eye screenings are so important, because we can pick up so much issues with the eyes or with the body through the eyes. You know, diabetic retinopathy is something that is very prevalent in Trinidad and Tobago. In particular, Trinidad. We have, where I work at the Trinidad Eye Hospital, quite a large number of patients will come in because of diabetes, right? There are different types of diabetes, and there are different, well, not different ways to diagnose it, but there's mainly one way to diagnose it, and that's by doing frequent eye exams. Right? If you stay home and you relax and you're not even going to notice that something is wrong, because sometimes it doesn't affect the part of the eyes that we use most of the time. Right? It can cause significant bleeding to the back of the eyes. Right? It can cause detachment of the retina. And when the retina is detached, if we don't see about it in the early stages, then chances are it's going to be irreversible. Right? I've had quite a few patients who will come in and they see well. They see 20/20. We all hear 20/20 vision, perfect vision. Some of them see 20/20, and when we look at the back of the eyes, Taufik, it's bleeding all over the place, right? And then we will send them across to the ophthalmologist, who will then try to control the bleeding. Sometimes, yes, they are successful in controlling the bleeding. Sometimes they are not. But what is very important to protect the eyes is diabetic control. And that's where you would come in, right? Because oftentimes I would have patients, whether it be old patients, whether it be young patients, and we see diabetic changes to the back of the eyes. And one thing we do before the eye exam for every diabetic, some places might do it for everybody, is check their blood sugar. And we often ask them, especially diabetics, not to eat at least 2 hours before the exam. So that way we get the sugar hopefully less than 150. Because if the sugar is high, it also causes the lens in our eyes to become a little bit swollen. And sometimes your retina can become a little bit swollen. And that can actually affect your prescription. So patients will come. Just yesterday I had a patient who was upset with me because her sugar was high. And we told her, relax a little bit, let's check it back and see if it's going down. But it was going up, right? And she said, for the past month or so, my sugar's always been high. And so I didn't proceed to do the eye exam, but what I did was I told her, you need to go and see your general practitioner, your family medicine practitioner, and get the diabetes under control, because while it might be damaging your eyes, and that's my concern, it might be damaging other organs in the body as well, and that's important for her health and for her survival, right? So is very, very important. You know, once you're diabetic, you need to do frequent eye exams, at least every year, sometimes even 6 months, sometimes even 3 months, right? Because if we catch it in the early stages, if we catch any diabetic changes in the early stages, we could prevent vision loss and preserve the eyesight. But if we catch it too late, the damage is oftentimes irreversible and is permanent. And, you know, it's unfortunate, but sometimes we want to help the patient, but sometimes we just can't. Yeah.
Very important stuff there, Karim. So as you say, it is a cooperative effort between the different medical professionals to really get the diabetes under control in these patients. And as you say, oftentimes a patient they may have some blurry vision, or they may have a refractive error, meaning they need glasses, and they go to the optometrist, and the optometrist do a check of the eye health. And when you do the check, they see changes to the back of the eye that would indicate diabetes.
Correct.
And that is where the cooperation between the optometrists and the doctors come into play. Because as you say, it is a glimpse into the eyes, a glimpse into the patient's overall health. So when you see things like this, you will refer them to a family medicine doctor like myself. And if you are having problems in controlling your diabetes, you could always feel free to contact me, WhatsApp me. And this catching this disease early is so important, right, in preventing more serious complications in terms of your eyesight, because I've seen a lot of cases where patients have become blind from diabetes, where the bleeding is so extensive that they cannot see, right? They only have vision that they could perceive light, but they cannot see anything else. They may get, as you mentioned, retinal detachment from severe bleeding from diabetic retinopathy.
Mm-hmm. Yeah, so just to let the viewers be aware, this is not just something that happens to old people. You know, oftentimes you would think, we in our 30s, Tawfiq, and we will think we're invincible. But I'm sure, just like me, you don't feel the same way you felt when you was in university. You know, we can feel aging. And so but we still think we are invincible, and we think that these things not going to affect us until, 60s, until, 70s. Tawfiq, I've had patients, I've seen patients in their 20s, in their 30s, in their 40s, and they have severe damage to their eyes due to lifestyle diseases. Not just diabetes, sometimes high blood pressure as well, right? And the thing is, the sad part is, the solution and the treatment, once it's caught early, is very simple, right? But we take it for granted. A lot of people take it for granted. I myself, just for lunch I had a donut today. You know, we have to control our diet, and we have to exercise, and we have to be proactive. You know, we will take our cars to go by the mechanic every 5,000 kilometers, 10,000 kilometers, or every 6 months, and we will service it religiously. We don't miss a day. But we don't go by the doctor. We don't go for a regular checkup. Our parents or grandparents, they died from diabetes. We know it's in the family, and we don't go and get a checkup. You know, but we will take care of the material things, and we forget about ourselves, right? But it's very important, because once we catch these things in the early stages.
Well, you raise a very important point there, Karim, about going to a medical practitioner to screen for certain diseases. Now, the recommendation for people who are diagnosed with diabetes is to get a check for diabetic retinopathy at least once for the year. But this is a special case. Tell us in general, how often should a person get an eye check by an optometrist?
So I like to recommend to all my patients from young as little as maybe 2-3 years till you die. Every year you should do an eye exam. You know, they have some guidelines where they will say 1 to 2 years for a person who doesn't have any medical conditions and so on. But like I've been emphasizing, any issues to the back of the eyes, once we catch it in the early stages, we can most of the time prevent permanent damage. But if it's missed, then damage is irreversible. So that's why I like to tell all my patients, Tawfiq, every year, at least every year, do an eye exam. You're only changing your glasses when needed, right? So if the prescription is the same, you don't need to change your glasses. If your glasses is in good condition, it's not broken, it's not scratched, you don't need to change it, right? but you need to look at the health of the eyes. And this is why you need to choose a good optometrist who focuses a lot on eye health versus selling glasses, to be quite honest. Yeah?
Yeah, very important points there, Kareem. So let's just shift gears a little bit. So in my family, we have a family history of this disease, a disease of the eye called glaucoma, right? From what I know, I wouldn't say what I understand, from what I know, it is something that is hereditary, right? And it's an increased intraocular pressure, if I'm correct. So just tell us a bit about what exactly is glaucoma, and a bit about the pathophysiology of glaucoma, a bit about how it affects us.
Right. So what is glaucoma? So glaucoma is not always linked to the high pressure in the eyes. Sometimes you can have what they would refer to as normal tension glaucoma, right? Where the pressure is normal, but you have glaucoma. So it's really and truly when there's a bit of a strain on the nerve to the back of the eyes, right? And when this nerve to the back of the eyes becomes damaged, it's going to affect your vision. But what not the funny thing, but the scary thing with glaucoma is that glaucoma doesn't show up any symptoms at all until it's too late, right? They refer to glaucoma as the silent thief of sight. And that's because glaucoma affects your peripheral vision, right? So where the nerve connects to the back of the eye, how I like to describe it to patients is, if you could see my hand on the screen there, the nerve is around here on the back of the eye, and then it sends out signals all the way out to the outskirts of the back of the eye. But when that nerve becomes damaged, then the signal doesn't reach all the way to the end of the back of the eye. It doesn't reach all the way to the periphery. So if an image is formed or the light is focused on the periphery, then we don't have much vision because there's no signal there to reach to the nerve. Right? So then we begin to lose our peripheral vision. So if I'm looking straight ahead, the ability to see on the sides, that's my peripheral vision, right? We begin to lose the peripheral vision, so it comes in. But then if I'm losing the peripheral vision on my right eye and not the left eye, I have the left eye to compensate, or vice versa. So we don't really notice that the peripheral vision in one eye is going until it's gone. Mm-hmm. And then sometimes we end up with what we call tunnel vision, like you're looking through a telescope or binoculars. Mm-hmm. And this is when, once this damage is done, that area, the back of the eye, when that signal is lost from that area, the back of the eye, Tawfiq, we can't do anything about it. Mm-hmm. We can stop or slow down the progression of the disease. We can prevent it from getting worse, or try to prevent it from getting worse with simple things. Initially, we would use simple things like some eye drops, different types of eye drops, right? If it's far gone, we may do certain types of surgery, right? Well, not we, I should say the ophthalmologist would do certain types of surgery. In Trinidad and Tobago, the optometrist can diagnose or detect signs of glaucoma, and then we send them off to the ophthalmologist, who will then treat it. So a simple thing as eye drops, but as you said, hereditary. Glaucoma has an extremely, extremely hereditary link. Mm-hmm. So if it's in the family, your parents, but more important, if your siblings or one of your siblings has glaucoma, chances are the rest of the siblings will get it, right? Very strong hereditary link. And what I like to tell my patients is very common in people of color, right? People majority of us in Trinidad and Tobago have brown skin, right? It's very common in people of color. It's also common in people of African descent, and it's also common in people of Asian descent, right? So once you have these risk factors, you're of African descent, you're of Asian descent, you're of color, and it's in the family, right? When it's in the family, that's also very important. Doesn't mean to say you're not going to do an eye exam if glaucoma is not in the family. We need to check, right? And that's where frequent eye exams are important. I've had a patient, was it today? I think it was, or yesterday, 44-year-old Tawfiq. They've never had an eye exam before. Thankfully, alhamdulillah, that patient had no issues, no damage or anything to the eyes, no medical conditions, and so on. So that was fortunate. I've had patients who, in their 40s as well, who've never had eye exams, and it wasn't as fortunate. Mm-hmm. But as early as you're in preschool, you're 3 years, there are optometrists out there who can see 3-year-olds, who can see 2-year-olds. Your pediatrician can assess the eyes and make sure it's functioning well and so on. But ideally, once your child can communicate, most optometrists would be able or should be able to see them, right? So it's important to go for that eye exam from then, right? But yeah, with glaucoma, like I said, frequent eye exams. Once we detect it, we send you to the ophthalmologist, and they will then treat and help, hopefully, prevent damage from happening and preserve your eyesight.
Right, so you mentioned a few of the risk factors there with ethnicity, a hereditary link, right? What I want to ask you, what tests do you do as an optometrist to say, yes, this person have glaucoma or that person doesn't have glaucoma? Is there a particular test you have to do?
So, you know how we were saying the eyes are the windows to the soul. The eyes are the windows to seeing medical conditions going on with the body, like diabetes and so on. We can also look at the back of the eyes. The optometrist will normally have a little scope that they come very close to your face with, called an ophthalmoscope. We use that scope. There are also other methods that the optometrist would use to look at the back of the eyes and examine the health of the nerve and the retina around the nerve. Those things are very important, right? The optometrist can also put eye drops in your eyes to dilate you. So the pupil, it opens up. So we have a better view of the optic nerve to the back of the eye. Right? The optic nerve is that cranial nerve that connects the eyes to the brain. That helps us and is very important for our eye function. So yes, the optometrist can look at the nerve, assess it, and if it looks suspicious, because there are certain ways the nerve would look, that would tell us or give us an idea that there may be glaucoma, right? So then what we would do is either one, we can send them straight to the ophthalmologist for further assessment, or two, we can send them for specific scans. A scan called an OCT, which stands for optical coherence tomography. It's kind of like, I describe it to the patient, it's kind of like an ultrasound of the back of the eye. So it maps the optic nerve, and it maps the layers of the retina around the optic nerve to tell us if there's any thinning or any damage to certain layers in the retina. All right. Also, we can send the patient for something called a visual field test, which maps the visual field. Now, it's a very tedious test, Taufik, but it is a very essential test in diagnosing glaucoma and monitoring the progression of it. So the OCT, the optical coherence tomography, and then the visual field test. Right? Those things are very important. So the optometrist can send you some optical clinics have these machines there where they can do it, and they can tell you if there are signs of it. And if there is signs of it, then we will refer you to an ophthalmologist who will do the treatment for glaucoma. And like I said, the treatment is sometimes a simple thing as some eye drops every night, right? And if it's far gone, of course, there's other things that the ophthalmologist can do.
So the ophthalmologist will do the diagnosis and treatment, right? But what I want to ask you, what is the definitive test to say yes or no you have glaucoma? And the other thing, yes, the treatment will be prescribed by an ophthalmologist, but what is the regimen and what the drops are like? So somebody might be afraid to go and get screened for glaucoma because they might say, if I find out I had this thing, I had to treat it. So is it something difficult to treat it? Does it cause a burden on your life if you have glaucoma?
It definitely doesn't cause a burden, because I mean, in Trinidad and Tobago we have CDAP and all that. I'm not certain that if glaucoma drops are on CDAP, but there are affordable glaucoma drops that patients can get. I mean, every pharmacy, the price would be different. I'm not sure the exact cost of the eye drops, but to me, once you realize you have an issue with the eyes and the ophthalmologist confirms the diagnosis of glaucoma, and how they would confirm that is through doing the OCT, the scan, the field test as well. Something that we do for patients who have the glaucoma that is caused by the high pressure in the eyes, we also measure the thickness of the cornea, right? So that way we have a correction value for the pressure in the eyes when we check the pressure in the eyes. So that's something that we will do. We will check the thickness of the cornea, the OCT, the visual field test. and then the pressure in the eyes. So those 4 things that we will do, and then the ophthalmologist can make a confirmed and a final diagnosis. And then depending on how far gone, they have different drops and different classes of drops that the ophthalmologist would decide on how to use it, when to use it. In the early stages, the drops, they would normally use it every night. In the far gone stages, the drops, they may have to use it 3 times a day, or they may have to use a combination. Drops that work in different ways to help regulate the eye pressure and the production and outflow of fluid in the eyes and so on. So, like I said, once we determine how far gone the glaucoma is, then they would decide on the eye drops and the type of eye drops that they would use. And like I said, there are, as far as I know, affordable eye drops that patients can use. And it's simple. Most patients can put the drops in their eyes themselves, right? But it is something that is lifelong, right? It is something that they have to use. Once diagnosed, they would most likely have to use it for as long as they live. But like I said, once they use the drops like they're supposed to use it, the glaucoma may not get worse, and it could be under control, right? Some people, they depend on someone to put the drops for them, and they do have people put the drops for them. They even have companies, Tawfiq, they make things to help you put the drops in the eyes easier. You attach it to the bottle and you rest it there and you just raise the head and all those things. So all those things are available to patients. Patients just, reach out to your ophthalmologist, your optometrist, if you have these things, and I'm sure they would all be willing, to assist.
So in other words, you give a very detailed explanation there, but in other words, glaucoma is something that is quite manageable. It is a chronic disease, means once you diagnose with it, you have it for the rest of your life. However, it is as simple as putting some drops into your eyes, which can prevent you from becoming blind, because as mentioned by my dear friend, glaucoma could cause peripheral damage to the peripheral vision, and then it comes in closer and closer, and it could even lead to blindness.
Correct.
Right? So one last question on glaucoma, and that is an important question from my point of view, because as a family physician, we like to screen, we like to prevent disease before it starts to affect the patient,
Right.
pick it up in the early stages, right, where we have primary and secondary prevention, right? So what is the screening guidelines, and who should be screened for glaucoma?
So once glaucoma is in the family, definitely be screened. How are you going to be screened? Every company, every optometrist may screen a little bit differently, but it's important to check the pressure in the eyes, and it's important to look at the nerve health. You don't have to go and pay a set of money just to do these scans, but once you have the glaucoma in the family, it is important to at least get a frequent eye exam, and let us look at the health of the eyes. From looking at the health of the eyes, the optometrists are trained to not diagnose, but to detect the signs of glaucoma. And once we see any signs of glaucoma, that's when we're going to refer out. There are companies that go around and they do screening. We partner a lot with the Diabetes Association of Trinidad and Tobago and do a lot of screening for diabetic eye disease. And sometimes you may look at they'll take photos of the back of the eye, and they will assess those photos for diabetic changes. They will assess the nerve as well. If the nerves look suspicious of glaucoma, then we will let them see either the optometrist or the ophthalmologist. And if they also think it looks suspicious, then again, further examination, apart from just the initial screening.
So a very comprehensive explanation there by my friend on glaucoma. He explained a lot of things. He explained the risk factors, the screening guidelines, how does the disease happen, how does the disease affect the body. He even explained about the treatment of the disease of glaucoma. Now, I would like to take myself back to primary school when I was in Standard 4. And I was to sit to the middle of the class. And then one day I realized I wasn't seeing the board properly. So I asked the girl who was sitting to my right, I say, "You seen what Miss Wright on the board there? Because I can't make it out. Is it clear?" And she laughed. She thought I was making a joke with her, but in reality, I wasn't able to see on the whiteboard right? Because I had a refractive error. I needed glasses, and I was getting persistent headaches, and it was an SEA class then. So it started to affect me, and this is where I went to the optometrist, and I was diagnosed with a refractive error and given her glasses. So it's a common thing that happens with kids. They have refractive errors. So Karim, we want to discuss a bit about the kids now, right?
Yeah.
A bit about the kids that may be experiencing a similar story to me. However, back in our day, we probably didn't have as much devices. So that was something that was a bit different in our day. But what I want to find out is, what are the early signs? Now, I picked up on it because I couldn't see the board.
Right.
Now, parents may start to pick up on these things too by observing things with their children, or even the children complaining to the parents about things that are affecting them. So what is my question to you is, what are the early signs of a child having a problem with their eyes, whether it's refractive error or otherwise?
Where you used to sit in the class?
To the middle.
The middle.
Yeah.
So when I was in primary school, I used to sit to the front all the time. I was always under the teacher nose. So I didn't have a problem seeing the board. But when I started secondary school, we had to sit in alphabetical order. So I ended up in the back of the class. And that's when I realized I had the issue.
Yeah.
So for me, I may have been short-sighted in primary school as well, but I didn't know because I was always in front. So I could have seen the board then. But when I moved back a little bit in secondary school, that's when I realized that I couldn't see the board properly. So that's where I want to say, before I tell you some of the signs, sometimes I may not even have signs, right? Like my case, I didn't have any signs, and I didn't go for an eye exam. But I went, when I realized I had an issue, then I asked my parents and they took me for the eye exam. So that issue would be blurry vision. For the child, they would experience blurry vision. They wouldn't be able to see properly far away. Some cases they may not be able to see when they're reading. So what that child may think that vision is normal, right? But what we as parents and teachers, what they can look out for, what you can look out for is things like squinting, or they're holding the book very close, or they're going up very close to the television at home, or they're going up very close to the board in school, or you see the child there sitting and they're tilting their head and they're trying their best to see and the eyes are squinting down, right? They're rubbing the eyes, they're complaining of headaches. You see them at home and they're on the phone and the cell phone is all the way up here and they're looking at it, right? All those things we as parents and teachers can look out for, grandparents can look out for, look at the children and, take them in for an eye exam when these things happening, Tawfiq.
Very important, because a lot of children even present to me with headaches. A very common complaint among children. And you do investigations and you can't really find a reason for the headache, but when they have their eye tested, they need glasses, and that is a common cause of headaches, especially, I would say, from the 8 to 9-year-old, where they might start to develop a short-sightedness.
Correct. Yeah.
Right? So, at what age should we start to screen these children?
I would say as early as when they're in preschool, right? I want to talk a little bit about the different types of refractive errors that the children can have, right? Because there's a lot of research going into something called myopia. Researchers now refer to the word myopia as a disease, or the condition myopia as a disease. And the disease is that the eyeball is longer than it should be. And the symptom is short-sightedness. So some researchers are referring to it as a disease, the symptom being short-sightedness. In the past, we would use the terms interchangeably: myopia, short-sightedness, right? So what happens with myopia? Your eyeballs are longer than normal. So, and this is where physics comes in. As the light enters the back of the eyes, an image is formed. And that image should be formed onto the back of the eye in order for us to see very clear and sharp. But with myopia, the eyeball is longer than normal, so the image is formed to the front of the back of the eye. And the eyeball is already longer than normal. So if I'm 6 years old, I'm 10 years old, and my eyeball is longer than normal, and I'm growing, what's going to happen to the eyeball is also going to grow. So that's where myopia is considered to be progressive. Researchers predict that by the year 2050, so next 25 years, 50% of the world would be short-sighted. Why? Not just your cell phone, right? Not just the phones.
Yeah.
Parents often come and they will say, you know, Mr. Kasmali, tell her, stop being on the phone so much, stop being on the tablet so much. Yes, it contributes to the short-sightedness, it contributes to the myopia. But also reading a book and you're holding it here, you're doing excessive amount of near work and the eyes are uncorrected or undercorrected, it causes the eyeball to grow longer. So the longer a child the child becomes short-sighted and the longer they go without getting the glasses, is the longer the eyeball can actually grow, right? The more near work that child does, is the longer the eyeball can grow. So for children, what we would recommend? We recommend for children do eye exams as early as they can communicate with the optometrist. Yeah, before that you can do regular eye health screenings with your ophthalmologist and your family medicine doctor, right? And also they need to do the eye exams and wear their glasses all the time.
Right. So Karim, I just want to ask you one last question here before we go. All right, this question is about protecting the eyes. So in my years of experience in working in accident and emergency department before I went over to family medicine, a lot of people come to the casualty with a foreign body in the eye from grinding. Everybody and a grandfather using a grinder and cutting something and without eye protection. And he also mentioned about reducing the screen time. So just very briefly, in 30 seconds, tell us about protecting the eyes from the phone and protecting the eyes from damage from these grinders. That's what is so dangerous.
So researchers give us a guideline for the protecting the eyes from the phone, 20-20-20 rule. It's just a guideline. It's not, it's not gospel. It's not something to just take and it's concrete. It's just a guideline. Every 20 minutes, take a 20-second break, look at something 20 feet away. Eye add in, remember to blink, right? Doesn't have to be 20. The gist of it is, ever so often, take a frequent break. Take frequent breaks when you're doing your screen time. You're on the computer, you're reading, for everybody, children and adults, right? Look at something far away, at least 20 feet away, where the eyes will be relaxed, right? For a couple of minutes, right? And with respect to the grinder, they always just lift the safety glasses off the face to make sure they're cutting straight and it pitch in the eye. I always see it. I've seen multiple patients tell me that. It's very important when you're doing construction, you're doing grinding, you're doing any kind of work like that. You're cutting grass, you're whackering, how they call it. Wear safety glasses, wear a face shield. That's really, really important. You only have two eyes, right? You don't want to damage the eyes because, like I said, damage with the eyes could often be permanent. You don't want to lose your eyesight.
Very important and comprehensive words from my dear friend, Dr. Karim Kasmali, an optometrist. So he has explained a lot about the eye, a lot about eye disease. And we have to remember that our eyes, just as I said last time with our health, is a manna from Allah. It is a trust. It is something given to us as a favor. And we should not deny any of the favors of our Lord. And in this way, we should always take proper care of our eyes, as they are so essential in our everyday living, and without them, it will be very difficult to function. So with these few words, I would like to thank my dear friend, as he say, I am his oldest friend. I would like to thank him for being present today and providing such an informative session with us. Again, thank you, Karim. And Assalamu alaikum, and we will see you next time.
Construction Services and Supplies Limited has built a reputation